10 things about menopause I wish I knew 10 years ago. Number one, menopause is so much more than just hot flashes. This represents a time of a dramatic increase in her risk of death, obesity, and chronic disease. Number two, there are 37 signs and symptoms of perimenopause and menopause to include anxiety, depression, belly fat gain, loss of sleep, less sexual feelings, pains, dry skin, itchy ears, headaches, and more. If your provider is telling you that the signs and symptoms that you are suffering have nothing to do with menopause, she is probably wrong. It is completely reasonable for a patient at the age of 35 to begin having symptoms. Number four, even those of you with the most disciplined exercise and nutrition habits can have a sudden change in your body composition, leading to an excess of belly fat due to the changes associated with perimenopause and menopause. Number five, you're not alone in this journey. Every single one of us is going through this together. None of us will get through life without going through perimenopause and menopause, even though our symptoms may be very different. Number six, if you're being dismissed and told that your symptoms are just in your head, it's likely that the person providing this advice has no training in perimenopause and menopause and can't recognize this constellation of symptoms. Number seven, nutrition and exercise are some of the most effective treatments for some of the symptoms of perimenopause and menopause, yet the most underutilized. Number eight, the time to begin normalizing the discussion of perimenopause and menopause and what we go through in our symptoms is important, not only for each other, but for the next generation of women who aren't experiencing it yet. Number nine, help is available. If you are suffering, you don't have to. Find help. And finally, the pause is not the end. It's a beginning. It's a pause to breathe, to reassess, and it begins now.